Sierra Leone is a developing country in West Africa bordered by Guinea, Liberia, and the Atlantic Ocean. The climate for women in Sierra Leone is slightly better than that of other African countries. However, women still face many challenges, especially when it comes to healthcare and health equipment. According to a study by the United Nations in 2015, Sierra Leone has one of the highest maternal mortality rates in the world of 1,360 mothers dying per 100,000 live births. According to a study done by Dr. Lafumba in 2018, there is also a shortage of healthcare workers, making it difficult to lower these maternal mortality rates. However, according to AMREF Health Africa, just one trained midwife can look up to 500 mothers every year and safely deliver 100 children, which would hopefully lower these rates. Another health concern is the prevalence of both obstetric and traumatic fistula. Obstetric fistula is the result of a prolonged and obstructed labor, while traumatic fistula is the result of sexual trauma. Rape culture is also a norm in Sierra Leone, making psychological damage, the transmission of STIs, and other various health concerns common. We, Students Without Borders, hope to tackle this issue. As an organization, our mission is to provide safe, accessible maternal health care to women and girls, as well as educate the population about threats to maternal health in Sierra Leone, while our vision is to decrease the percentage of maternal health problems, increase access to better medical technology, and provide resources for the people of Sierra Leone to help them improve female-related health issues.
Our first objective is to open a training facility to train at least 100 midwives in Sierra Leone within the next 5 years. These midwives will help women in rural villages deliver babies safely. Our second objective is to increase awareness about maternal health by going to 100 schools and communities and talking about safe medical practices. Our third objective is to provide access to sterile medical equipment and first aid materials to 10 different villages, such as blankets to keep newborn babies warm and sterile blades for cutting umbilical cords.
Some risks that we may encounter are possibly overstepping cultural boundaries, so we are keeping our focus on women's health rather than methods of contraception. Another worry was that children who are not in school are at a higher risk of not receiving education on health. Thus, we are holding community meetings as well as speaking at schools. Our mission includes having access to sterile equipment. However, that equipment can be very costly, so we are partnering with Aberdeen Women's Center and Doctors Without Borders in order to provide more tools and combine fundraising efforts.
In order to determine whether our project has been successful or not in the targeted areas, we will need to be able to measure some data. First, we can measure the maternal mortality rate in targeted areas. It should be decreasing to prove that the midwife training program is succeeding. After going around to the 100 schools and communities, we can measure the impact our speech has had on the people by surveying them to see how much of the information they learned and whether it has influenced how they prioritize women's health. In order to measure how successful our sterile equipment is, we can check back in 5 years to see if the equipment has benefited the community and if it is still being used and being used properly. We can also measure the infant mortality rate to see if the sterile equipment improved conditions for birth to help children be born with less health concerns.
The implementation partners that we plan to work with are Aberdeen Women's Center and Doctors Without Borders. According to the Freedom from Fistula Foundation, Aberdeen Women's Center is a healthcare facility in Sierra Leone that provides comprehensive fistula repair to injured women, treating up to 300 patients a year. In addition to treating fistula, Aberdeen Women's Center aids in maternal and reproductive care, safely delivering an average of 200 babies a month. Our other implementation partner, Doctors Without Borders, describes themselves as an independent organization that provides healthcare to people in distress in countries around the world. They deal with medical care, disaster response, and advocacy for these topics.
In years 1 and 2, we will finalize plans for and build the midwife training facility. In year 3, we will recruit and begin to train midwives. Over the course of year 4, we will go to schools and educate the Sierra Leone population about maternal health issues, and at year 5, we will finish educating at least 100 midwives.
Here is an interview done with Laura Drew, an obstetric fistula expert, about the issues facing Sierra Leone.
I think it's important to help women with obstetric fistula in Sierra Leone and other settings because I really do think that obstetric fistula is one of the most devastating conditions that a woman can endure. It's something that's kept private. It's something that affects life. She lost a child usually. And I just think it's really, it's an injury that just happens just by, the curse of being a woman. And it forever changes their life and their perception of their own value and the perception other people have of them and their own value. To talk with a woman who's endured obstetric fistula is to talk to a survivor that we really can't even comprehend what they've gone through. Women in many places aren't valued as equally as men, and just the fact that women have these additional health concerns in settings where women also aren't valued, it's really a double burden for women, and I think that's why it's so important to address it. And also, it affects the health of her own family and the health of her children.